Hi everyone, so I'm currently in Thailand as a part of a medical mission trip, and I don't have much access to electronics or filming gadgets at the moment, so this will be a pretty simple video. I would just like to share what I've experienced working at the Monash School of Public Health and Preventative Medicine. So I'm interested in programming, and I really wanted to do a project that allowed me to practice my coding skills but also bring something useful to my team. So I was very lucky to be placed with the epidemiological modeling team here with my supervisor, Dr. James Trower. And they heavily focus on using Python and R, two high-level programming languages, to develop models and software that can map infectious disease outcomes for a particular population. When I first arrived, my team already created an amazing software called Autumn that was able to create any model for tuberculosis. For my first 2 weeks in the office, I worked on another project that involved creating a software called Summer that could model any type of infectious disease. I particularly focused on the outputs of the software, ensuring that a flow chart of the model and multiple graphs could be easily created by the user. This was an amazing experience for me, as I was able to combine my medical expertise with software development, and I came out from the first 2 weeks understanding how modeling works. In my last 2 weeks, I ended up writing up a literature review on the effects of BCG vaccination in adults. The BCG vaccine is one of the most common vaccines used to prevent tuberculosis in children, and previous systematic reviews have shown the really positive outcomes of the vaccine in children. However, there is not much evidence that highlights positive effects in adults, and some studies have even shown a significantly detrimental outcome in adult groups, such as a randomized control study group which was done in India with over 366,000 patients, which is a very large sample size. Other studies just show insignificant results. With so many different results from multiple studies, this drove me to also attempt a systematic review to ensure that we are not missing any data and evidence regarding this topic. So we are still working on this systematic review, and at this stage we have completed selecting the studies, and we are still in the process of reading through and extracting the data. Depending on the results, we are also hoping to produce a paper that involves modeling tuberculosis in adults without vaccination, as well as hopefully creating other studies that focus more in depth on this question.